Hello, everyone, and welcome to another episode of Community Catalyst podcast. I'm Lynn Boyer, Executive Director of Community Impact and your host. And today I have two guests joining me from Southern New Hampshire Medical Center, and I will let them introduce themselves.
Sure. So my name is Betsy Houde, and I am the Executive Director of Community Partnerships.
And I am Kelly Yellick, and I am the Program Manager of the Cardiac and Pulmonary Rehabilitation Department.
Great. Thank you and welcome. I'm so glad that you guys were able to join us today to talk about this very important topic. So first, just please share what your organization does, where it's located, who it serves.
Well, we've actually been around since 1893. We started as 8 beds in the basement of a police department and have grown to have over 2,600 employees and provide healthcare for the entire region from really sort of Milford to Pelham and up as far north as Merrimack. We have the medical center in downtown Nashua that has 188 beds and then have over 70 primary and specialty care practices, immediate care locations, to really do everything we can to help people be as healthy as they possibly can.
Great. Thank you. Kelly, anything you want to add to that at all?
Yeah, just that the Cardiac and Pulmonary Rehab program has been around for over 20 plus years. And it also started as a small department, a program inside the medical center. And we've grown to now we're lucky enough to be on the West Campus, one of the satellites of Southern New Hampshire Medical Center. And that's wonderful because we have a much bigger space so we can accommodate more patients and then give them kind of a greater variety for exercise equipment and just kind of as the whole health and wellness and evidence-based practice comes to develop with heart and lung disease, we've been able to have that space to adapt our practice. So it's awesome.
That's great. Sounds like a lot of growth in able to serve the community better. That's great. So what are some of the partnerships or collaborations that you've had with the Y or plan on having with the Y in the near future?
You want to jump in with that one, Kelly, and then I'll add?
Yeah.
Okay.
So I've been with the medical center for close to 12 years at this point, and I feel like there's always been a relationship with the Y in some capacity because to me, it's a no-brainer that the Y serves the community and so do we. So how can we do it together? So we have done programs such as tobacco cessation. That was wonderful to do with the Y. And we've also just started a new kind of collaboration where our patients, when they are done with their rehab setting of working with us for heart and lung disease, that we're kind of introducing them to the Y as a fitness and health and wellness progression. So they do their rehab with us, they get healthy, they get confident in exercise, they know it's a lifelong journey, and we've kind of just helped them get started on it. So it's like we start it and then the Y kind of picks it up from there. And we love how there's something for everybody at the Y. I mean, you have healthy population programs all the way down to programs for people with Parkinson's disease. And now this Vital Beat program that we just started to collaborate with the Westwood YMCA is for our cardiac and pulmonary patients to have a safe environment to exercise and continue to get healthier.
Well, you know, the concept where everybody has a second home, you know, whether it's your favorite cafe or bar or something is, in my mind, we've really tried to connect with the Y so it becomes the second home for our patients and for our staff. To provide that incredibly supportive and nurturing environment. When we were developing our Center for Weight Management a couple of years ago, the first thing I thought of is, you know what, let's partner with the Y so they can teach people and really hold their hands as they're learning how to use equipment and that they'll feel really connected. So if they're uncomfortable, you know, being in workout clothes and working out alongside other folks, that would reduce some of their anxiety about that. And the Y absolutely stepped right up, and that program has just grown by leaps and bounds. And it's amazing that we're like almost across the street from your Westwood campus, because that's been a real lifesaver for people too. So we are so grateful. And we also work with young kids and families through Prescribe the Y. So if there's a child who's scoring kind of high on their BMI for their body mass index, their pediatrician is able to prescribe the Y whereas that whole family can go and start exercising at the Y and join some of your educational programs to get back on a track to health. So we really couldn't do what we do without all of that follow-up care that happens at the Y. And our staff too. We can talk more about that later, but we have a lot of staff who are members over there.
Yeah. Yeah, that's great. And I agree. I think our partnership really is a no-brainer, and it's a great bridge to each other, right? And it both support that health journey, whether it's, weight loss or health seekers for exercise, or like you said, rehab or some sort of support for them to feel healthier, spirit, mind, and body. So we really value our partnership as well. As you know, we recognized Southern New Hampshire Medical Center as a valued partner back at our annual event in November, because we truly do value that partnership as well. So great. What's something exciting that you guys have going on at your organization?
Well, I guess I'll jump in because we are so excited that we recently added a workforce development director. Because as everyone knows, since COVID, it's been a struggle to fill all of the open positions that we have, both in clinical care and non-clinical care. And we are developing so many different pathways with apprenticeship programs and earn to learn kinds of programs where people will be able to become a medical assistant or a licensed nurse assistant. And be able to then come and work with us with a guaranteed job. So we are being as creative as we possibly can for folks that might be interested in getting into healthcare.
That's great. That sounds like a really great addition for you. Excellent.
Absolutely. I would say with us to talk of our department, as you mentioned, February is a big month for heart health. So that's a big part of what we do is cardiac rehab and heart health and education and awareness. So we celebrated Go Red, and the whole system celebrated Go Red last Friday. So that was really special. And this week coming up is National Cardiac Rehab Week. So that's a great time to really have our patients understand that, yes, exercise and getting healthier, it's a commitment. And it's not just about moving on treadmills and equipment like that. It's about adapting that and really adopting that healthy lifestyle. So nutrition, stress management. So we celebrate that with playing games and having giveaways, and our dietitian makes some healthy snacks for this week. So they realize that this can be fun. It doesn't always have to be work. That exercise to me doesn't have to mean getting on a treadmill. It could mean going to the Y and playing pickleball, which I know exploded, especially at your Westwood location, right? Or being able to bring my grandkids to the Y and go swimming with them. So we really highlight that healthy is fun. So that's a big thing coming up with us right now. We have a new program for patients with peripheral arterial disease. So it's a specific type of cardiovascular disease, and that's something brand new that we just started in our department. So we're really excited about that because it's one of the few programs in New Hampshire that have a program like this. So we actually had a referral from someone from Mass General Hospital who lives in New Hampshire who wanted to do this program. And we said, yeah, we can do that with you. So that's really special to us.
Yeah, that's great. Kelly, can you explain what Go Red is, just for those who may not know?
Oh, absolutely. Go Red is really a campaign. It's been around for a long time, and it's for awareness of heart disease, specifically in women. So it's also known as the Red Dress campaign, because I think as females, we know that we have a lot on our plate, and sometimes our health can come second. And that means that we can't then take care of our family. We can't go into that workforce that we love and provide. So it's a reminder that heart disease is really important to pay attention to for both men and particularly women.
Great. Thank you.
And I do think too, as a woman, how many times do we sort of not feel quite right and just keep minimizing our symptoms? Or you just have to like power through and get your kids to school or cook that meal. And I think we just often put ourselves last. And I think this campaign really emphasizes the importance of, getting checked out and self-care. Because truly, if we're not taking good care of ourselves, we aren't able to take care of anyone else.
Exactly.
Yeah, absolutely. So we have a women's leadership resource network here at the Y. Ys across the country and ours as well is typically made of at least 80% or more females in the workforce. Just given the nonprofit type of work that we do, that just seems to happen. So we have a women's leadership resource network, WLRN here. So it is made up of female identifying staff. And some of the goals that we have are education and leadership and professional growth, as well as supporting each other. So I think there's probably an opportunity for us to partner more and focus on women's health and making sure that the women that are involved in WLRN are taking time for themselves and their health, and recognizing, that they need to participate in some self-care too. The whole idea of filling your bucket before others, right? The oxygen mask theory too.
Yes,
So,
exactly.
so I think there's definitely a way that we can connect on that as well. Because I do agree. I think as a woman and a mom of 3 boys myself, I tend to put myself last, and you have to remind yourself that you have to be healthy in order to care for everybody else. So that's great. What are you both most proud of your organization or the accomplishments of your organization?
When I think about it, and I think sort of more systemically, as I had mentioned earlier about workforce, we lost a lot of staff during the peak of COVID. I think they just had completely burned out, or they were lured away by sign-on bonuses at other healthcare organizations. So many of them have come back. So I am just incredibly proud of the culture that we've created here to really care about our staff and help them feel appreciated. And that really, I think, has translated to our patients, and the really positive feedback that we get from many of the patients that we care for. And, one of the perks we are able to offer to our staff is a 20% off a Y membership. And we know that a lot of people have really taken advantage of that. So I'm most proud of the culture, and I think it really is evidenced by the number of people who came back or who have been here, 25 or more years. Is really pretty mind-boggling.
Yeah.
Yeah, I kind of piggyback on that whole mentality is that Southern New Hampshire really is a special culture, and it starts with the top leadership and just the way that we were rallied and supported through COVID. Our department had to shut down for 3 months at the peak of COVID. And there were some cardiac and pulmonary rehabs in the area that didn't come back and who just now have started to reemerge. And we were fortunate to have support from the director level and then all the way up to leadership to say, no, this is a service we have to provide to our community members. And as staff, we were at home saying, well, people are still having heart attacks and their lung disease is at the point of ultimate importance, right? So we knew these patients needed us. And then when we were able to come back in a safe way, and we had patients tell us that they didn't go anywhere. They were afraid to go to the grocery store to see family members, but they actually felt safe coming to our facility. And our team, to me, I'm lucky to be the director or the manager of a team of 6, and we're like family, and we kind of extend that to our patients. So we were able to support each other and then our patients, and we kept them safe. And not only that, but they were then able to thrive. So these patients who have pulmonary disease and were terrified that they would get COVID and what did that mean? And we could just give them that security and confidence to say, we're going to keep you healthy by continuing to exercise and take care of yourself, while at the same time be safe if something does happen. So that was really an amazing, it was a tough experience when we were going through it, but to look back and say, wow, we came back stronger. We learned a lot. We pulled together, and that's usually what happens in a time of crisis, right? You kind of pull together, and you just end up thriving because of it. So
yeah, that's great. So last question, this is a tough one because it can be hard to decide, but if you wanted to leave our audience with one thing that you would want them to take away about your organization, what would it be?
I guess from my end, I think about the fact that we're a city hospital, and so we don't turn anyone away. So no matter what your age or income is, or whether you have insurance or not, we're going to take care of you. We don't pick and choose who's allowed to come through our doors, 24/7. But at the same time, we are so focused on quality and have a really robust quality department and have so many certifications. I can't even like name them all, of accreditations, the number of stars that we've earned through all of the outcome tracking and efficiencies and workflows and everything that we've done is really just mind-boggling. And we are just constantly striving to create a better experience. You know, we've had a longstanding collaboration with Mass General to have their providers come up here, because we don't want people to have to leave the region or drive their family member down to Boston for care. We consult with folks at Boston Children's when we have premature infants who need like eye care, to make sure that they don't wind up having any deficits, you know, as they age. So even with our immediate cares, we started a virtual like telehealth kind of thing. They call it skip the trip, so that if you're not feeling well, but it's not something you need to like physically be in the presence of a provider, you can call and have a telehealth appointment and don't even have to leave your house. So I just love that we're constantly improving and evolving in creative ways to make the whole experience better for people. So that was probably a whole bunch of different things rolled into one. But I'm just so proud to work here. I've been here just over 5 years now. And yeah, I feel like everybody who is here really feels the same.
Yeah, I would agree with that too. I would say that with our organization, there truly is something for everyone. So no matter what age you are, no matter what your health status is, that there's going to be a place that we can help. And I think that there's a lot of preconceived notions to what a hospital might be like, or what a type of therapy might be like. And I feel like we do a really good job at accepting people where they're at and just kind of showing them that this is a safe place, and we're going to help you improve your quality of life, no matter what that means. Like I said, for any age, and if you have a disability, if you have a chronic condition, or if it's something acute, that something like really scary happened to you, you have an injury, we're going to make sure that you get the very best care. So that way you can kind of just go on to live your best life. So there truly is something for everyone. And especially like Betsy was saying with weight management, that's been just a wonderful kind of department that exploded for our community, to say like, this is a different specialty in healthcare. So, and it's really thriving. And I know they've been able to help so many patients. And we've actually had collaboration with some of those providers to say, okay, this is someone who came to us for weight management, but they also have a heart or lung condition, and then they come to us. So just that collaboration within all the departments will make sure that whatever you have going on, you're going to get cared for.
Right.
Well, and it's funny because when you said something for everyone, my mind went to workforce. We're like a city here.
Yeah.
You know, like I came from a really small nonprofit, and I was so like surprised that we have electricians and engineering people and materials management. And, you know, when I thought healthcare is a career, it's sort of like doctor or nurse, but we have, you know, lab techs and housekeeping and just so many different kinds of positions. And I'm really proud that we raised our lowest rate to $17 an hour. So no one here will ever make less than that. And so many opportunities to also move through our system. So not only can we take care of your health care, but we might also be able to give you a professional position in a great environment.
Yeah, that's great. And I think that's a great message for some of our younger staff too, our high schoolers or our, you know, college or recent college graduates. Same thing with the why. We have something for everyone, right? Business, marketing, finance. I have my degree in theater, so you can have a degree in almost anything and you know, find your place at the Y. And it sounds you know, similar to you guys as well. So that's great for our audience to hear. We employ a lot of younger staff. So for them to know that there's opportunity for them is wonderful. So great. Well, thank you. I really enjoyed our conversation. I know I definitely learned something about your organization as well, and hopefully our audience did too. So thank you, Betsy and Kelly, for joining us. And to our audience, thank you for joining another Community Catalyst podcast, and we'll see you next time.
Thank you.